All right. Good morning, Sanai. Sorry for the delay. Technical difficulties. A little bit of a problem with the connection. So, um, taking a while to get on. So, anyway, good morning and thank you for joining us this week for the COVID-19 and HHS update that's going to be presented today by Raylene Martinez. I wanted to make sure everybody understood that we are trying to get the word out about COVID-19 and things related to COVID-19. You will be have an opportunity to ask questions in the comment section, and we'll answer them live for you. Um, and what else? You can like, share, and subscribe on Facebook and on YouTube. That's where these are actually streaming live on. So, without further ado, we're going to turn the weekly report, over to.
Good morning, everyone. Good morning, San Alfonso, and everybody that is listening today. I would like to start with the COVID update this morning. The total active positive cases for the San Alfonso community as of today, January 27th, is 8. The total new positive cases for San Alfonso Pueblo between January 4th and today is 1. The total positive cases for San Alfonso Pueblo since November 2020 is 185. The total recovered cases as of January 12th was 175. The rising cases in the state of New Mexico yesterday had more than 4,000 cases. There were 40 deaths and more than 700 people remain hospitalized. We will continue to see a rise in death rates as the high case numbers and hospitalizations continue over the past 2 weeks. And the total number of cases in Santa Fe County is 240. In Los Alamos County is 44. And Rio Arriba County is 140 cases. I'd like to report that Omicron is currently the dominant variant right now. Those are the facts today. I will go ahead and turn it over to Rebecca, who will go ahead and give us a protection.
Okay, good morning. I want to talk a little bit about masks, how to choose one, and also how to care for our skin and maintain our dental hygiene and also our nasal passages. If you could bring up the presentation, please. It'll just be one moment. So the things I'll cover over the different masks, choosing mask, storing it, and when to replace it, and also hygiene. Next slide, please. So I'm going to go over the differences between an N95 and a surgical/procedural mask. An N95 is also your best protection against any aerosols or droplet particles. The reasons for that are because N95s go through a special machine process known as electrotizing. Essentially, they take a machine that they put the masks through or the material through, and it actually gives them a positive and negative charge, almost like what a magnet has. And what that does is it helps pick up the medium size particles that can be comprised of the COVID-19 of the particles. So with COVID-19, you can have anywhere from 0.1 microns, is how they measure it, to 0.5 microns. And the way these masks work with the multiple layers is that the larger particles tend to go in a straight line and they run into the fiber on the mask, and that's what stops those. The really small particles tend to get bounced around by other molecules in the air. And so when they move in a pattern, they tend to zigzag. And because of that zigzag, they tend to stick to a fiber on the mask randomly. Now, the particles that are the hardest to filter are those medium-sized particles. And the reason for that is because of their size, they actually move with the stream of air. And if a stream of air is coming and it encounters a solid object, it tends to go around the object. So when you have the electrotized material, it uses its positive negative charge to draw that particle in to the fabric. So it also, with an N95, you get a seal around your face. And what that does is it helps prevent air going out the sides and also air coming in from the sides. You'll know from wearing cloth masks that you can feel the air moving around the edge of the mask. It may even fog up your glasses, things like that. So the other thing is that N95s can be reused. You should never launder an N95. What happens when you wash it in laundry, even hand washing, or if you try to use a cleaning substance on them like hydrogen peroxide or bleach, that will degrade the mask material and it will also strip the mask of that electrotized property. Next are the surgical procedural masks. These also have some electrotized material in them. So you also don't want to launder them or wash them or put them through any sort of chemical treatment. They're better as far as protection goes. They have 3 layers at least. You can reuse these. And again, you want to be careful how you handle it. You can also get a mask fitter or brace to create that seal around your airways. One of the things I see frequently is people forget to keep their mask up over their nose. And we all know that you breathe through your nose and your mouth. So anywhere you're moving air, it's important to cover that. Next slide, please. And we'll talk a little bit about cloth. We know that they're inexpensive and easily obtained or made by hand. You can reuse them. You can launder them. You can add a filter piece. And you can also add a mask fitter or brace. Some of the cons about cloth masks is that they're not electrotized. They only have 1 or 2 layers, unless you make one with 3. And there are gaps that allow for air to move around. Any protection is better than no protection. However, I do recommend people seek the highest amount of protection they can obtain. Next slide, please. want to go over really quickly mask storage. There's one way you can just use a paper bag, and when you're done with your mask, put it for the day. Or if you wear 2 masks a day and you alternate them, you can keep one in a bag. You can also get a plastic container. What you want to be careful with is you want to provide small holes in the plastic container for ventilation. When to replace your mask. If it's dirty, like visibly soiled, if it's worn, it has holes, or if it's distorted, if it doesn't, the shape, it's lost its shape. Those are times when you want to replace your mask. Next slide, please. There's a lot on this page, but what I really want to emphasize is you want to be very gentle to your skin, especially if you're wearing an N95. And we all know they can rub your face, your pressure point here on your nose, behind your ears if they're ear loops. You want to watch for skin breakdown. You want to use a cream, lotion, or gel for moisturizing. Some of the ones that are really good for your skin are like the Aquaphor, which has dermatologist recommended. It's fragrance free and it's heavy. It's like an ointment. Another is like this CeraVe, which has ceramides. Is also recommended by dermatologists. And lastly, there's Aveeno, which has what's called dimethicone in it, and that creates a barrier to protect your skin. So those are some of the things you want to use. You don't want to over cleanse your skin, but you obviously want to wipe sweat away frequently through the day. And also, if you need to use a Band-Aid or some kind of cushioning to help protect your skin. Next slide, please. For your nose and mouth, they recommend that you brush and floss as usual, and then after meals or snacks too. Because we're wearing a mask, we're keeping all that vapor and droplets in. And so you want to make sure during this time to get your regular cleanings. You can switch your toothpaste if you're getting a lot of irritation around your mouth. Sometimes that's caused by things in toothpaste, like sodium lauryl sulfate. You want to avoid chewing gum. The reason for that is the flavors and your saliva mix and can irritate your face. For your nose, you just want to keep it simple. If it's irritated or congested, you can use a nasal spray like a saline spray or a saline squirt. You don't want to put any petroleum products up your nose for moisture unless a doctor advises you to. Next slide. And as always, wash your hands. If you take your mask off and put it in the bag, wash your hands. Go to do the same thing, put it on, wash your hands. So those are really important things. And I think I'll go ahead and turn it over to, are we doing this part? I'm sorry. Am I doing that too?
I can talk about that.
Huh?
So I can talk about that.
Okay, that's fine.
If you want to answer that question.
Sure. Currently in our situation, we need to do our best to preserve the protections that we have. There's a lot of debates, even among scientists, as to how long a mask should be worn. Some say 40 hours total before it should be discarded. If you keep your mask clean and in a safe place, where it doesn't get contaminated from other things or crushed. You should be able to use it for quite some time. Troy, did we have a consensus on how long we thought was good?
So the most recent information indicated that 25 uses is the safe way for for us individuals out here that are not in the medical field should be wearing our masks. So 25 times is it seems like a lot, but you're thinking if you collectively for one day would be one time. So 25 days is what they're saying would be a good day, a good time frame to keep an N95 mask just to make sure that you have some protection. Now, the only issue with it is if there is any soiling of the mask, if the N95 mask gets crushed and you can start feeling gaps or it's not fitting tightly to your face, or if it gets submerged in water. That's the reason. One of the reasons why we talk about not washing it, because the amount of protection kind of goes away if it gets completely submerged in water. So, um, but if you keep it like what Rebecca was talking about earlier, you keep your mask in the paper bags when you're not wearing it. You're trying to maintain the protection as much as possible. The only other option that you can do if you don't have a paper bag is utilizing the natural sunlight, the UV sunlight, UV rays from the sunlight, and putting your mask in. Say, for example, your on your dashboard when you're not wearing it, because it basically kills the virus that's actually on the mask. But overall, to answer your question, it's about 25 days, unless some of those other things happen. It gets wet or soiled, and soiling is not just on the outside; it's on the inside. So if you're wearing an N95 mask, like I wear mine at the gym, and sometimes I'll notice because I'm breathing really hard that the inside of the mask gets really wet and kind of soil, either from saliva or from just the condensation, whether it's from working out in the cold air or something like that. To me, that's too much. If it gets to the point where I can feel that it's really soaked on the inside, to me it's soiled, and I need to get rid of it and change it out. So those are things that you need to take into consideration if you're looking at how long the N95 mask is going to last. So, Jeannie, thank you for that question. Okay. Um, so we're going to go on to down the list of topics that we're going to cover today. Um, those topics are going to include vaccines, where we can get them, testing, where we can get them, and kind of reiterating the COVID hotline requirements and the access to the medical building um, throughout the week. So, um, vaccines, there has not been I think Wednesday was the last mass vaccination clinic that was being offered in this area. I think that one was actually in Black Mesa, so it really wasn't in the area. It's kind of far away, but that was the last mass vaccination clinic that was being offered. And the IHS has basically indicated that they are uh, pulling back on vaccinations, the vaccination clinics, the mass ones, because people weren't showing up for the vaccination clinics. And so when they were offering them, um, people would sign up for the vaccination clinics and not show up, or they would, you know, have 300 doses available, and 15, 20, 30 people would show up. So IHS is basically feeling as though the communities in the area are not necessarily in need of mass vaccination clinics. So until further notice, there will not be any more clinics scheduled in the area by IHS. But they are still offering vaccinations at the Santa Fe Service Unit. It is by appointment only, and we kind of advertised that before. Um, it's the appointment number is 505-946-9203. So if you need to get a vaccination, you can either go to your primary care doctor, or you can go to you can call that number for vaccinations. I'm going to put that number in the chat so to make sure everybody knows it's there. Um, Testing, we are still doing testing here at the Pueblo, here at the HHS building. It's also by appointment only. So the COVID hotline number, which I'm going to talk about here in a second, is the best way to schedule them. You still also have the home test option that we've been talking about, the ones you can order through the postal service or um, online, and you can also get some through your insurance company because they will um, give you those for free. And I think we put those websites on last week. But BTR is still doing testing, but it is by appointment only and by referral. You do have to contact the COVID response team to uh, let them know that you need to get tested. We'll send over a referral to BTR, and they'll set you up for an appointment. And IHS is also still doing testing by appointment only. Same appointment line number I gave earlier. So contact that number. You can either schedule appointments or vaccines. The COVID hotline number is the way that you contact us, 505-252-5986. During regular business hours, that is the best way to contact us. And when you're in the on call, there is someone who has that phone between Friday evening and Monday morning. So if there's an on call issue regarding COVID, that is the number that you contact. That is what we have so far for COVID updates. We're going to go into the HHS updates, the department updates next. But I wanted to give anybody in the that's listening or watching an opportunity to ask questions um, if they have them. Anything I missed? Anybody? Here, let me put you on. You're muted, so you have to unmute yourself.
Oh, sorry. So I recall in the update that we received that you could also go to the DOH website, the New Mexico DOH website, and they're offering quick view testing kits, and you can request for 4, and so that's available as well. Yeah, just as Troy mentioned, they were talking about how the interest has decreased for vaccination. So I think that is something important to consider. So,
And if any of you go out and get home test kits, no matter where you get them, if you test positive, I'm just asking you all, please contact us and let us know so we can provide you the services that the COVID response team can offer you. We don't want you to be, test positive and not have the supports that the department and the team can offer, because that's, one of the reasons why we're here. So if you do get a home test kit and you happen to test positive, please contact us and let us know. That is something that we would like to make sure everyone is aware of. Um, Anybody else have anything to add on COVID?
Good morning. This is Thelma. Yes, Troy, just like to add that contacting us and letting us know if someone has tested positive is very important, so that we can, identify individuals who we need to contact to make sure that everybody is safe in the community, and just to make sure that, this that we can catch people at a good amount of time to make sure that, like, again, like, it doesn't spread. But thank you.
Yeah, and as Thelma was saying, one of the things that's come up recently is the reason why there is such a concern about making sure we're monitoring folks who test positive for COVID is that the spread of of COVID, people were talking about how mild the Omicron variant is, and how it's not really anything to worry about. And so if you get it, it's not that big of a deal. But I want to caution everybody and remind you the reason why we keep having variants is because it keeps spreading. The more people that get COVID, the more the greater likelihood it is that um, there's going to be more mutations and more variants are going to show up, and that's what we want to prevent. In communities that have high unvaccinated persons rates, those are the ones I think are going to have a lot of the issues with the mutations. But it doesn't mean that just because you have high vaccination coverage in a community that we're not going to have the possibility for mutations. So, um, keeping away from folks. The blast that we send out, it always mentions about avoiding social gatherings and avoiding crowds, because the more people that get the virus, the greater likelihood it is that it's going to mutate, and the greater likelihood it's going to get to someone who does not have the protections or they are immunocompromised, and they're not going to be in the same boat as those individuals who are having those very mild symptoms or cold or flu-like symptoms that nobody has to worry about. I mean, those are people that whose immune systems are quite, um, as they call, robust and can fight off this virus. But there are members in the community that don't have that protection, even if they're vaccinated, because their immunities don't respond the way that everybody else's immunities have responded. The risk is still great for those people. The vaccination rates, the social gathering, reducing social gatherings, the wearing the masks, that's not just because you want to protect yourself. It's to protect those people who, um, you know, they are vulnerable or high risk or higher risk for bad outcomes, either serious illness or death, even. So that's why reporting is good. We can get you resources, we can help you out if you need something from the store. We can do those things to keep you from having to go out in the community and spreading the virus around if you test positive. So regardless of where you test positive at, whether it's here at our office, it's at IHS, your doctor's office, or it's a home test kit, just let us know. We want to try to do what we can to reduce the spread, because that's what's most important.
Yes, and I'd also like to add to that, checking our state reports, and it seems that about 90% of the folks who are hospitalized are unvaccinated. Every time you get, your vaccines, you get a booster, an additional shot, that really helps a lot. It helps you, it helps your family members, your friends. Something important to put in perspective is that, even surviving COVID infection, there is more and more evidence coming to light that is showing long COVID syndrome is really not a fun thing to live with. So, I want to make sure people understand what the risks are and why it's important to do all these things together to help protect each other and ourselves.
There's, of course, I know people have been kind of watching the news probably, and they've heard about stealth Omicron, which is the most recent mutation of the Omicron variant, which they've now sequenced as of yesterday. It's now in New Mexico, so it's not like these variants are not popping up all the time. But this stealth variant is not necessarily something to be freaked out about, but it is showing you that Omicron's been here in the United States for a month and a half, and it's already mutated once. So that is just enough to kind of point out that keeping people from being infected, doing your isolation and quarantine as the executive order indicates, and wearing your masks and taking all the other precautions is actually pretty important, because yes, we're having milder symptoms from a lot of people were having milder symptoms from the Omicron variant. But if you look across the country, the death rates are rising. Like Raylene was talking about earlier, the death rates are going to continue to rise within the next couple of weeks because in New Mexico, because we had that big bump in numbers. We had that 14,000 one weekend and 13,000 cases in New Mexico the next weekend. And so now the last few days, you're starting to see the death rates go from the 20s to the 30s. And now it was 40 yesterday because those people that were hospitalized, which is 709, I believe, as of yesterday, with Omicron. And this is not Delta, this is Omicron. And so as those hospitalizations and those rates start to run their course, you're going to see more people getting sicker and dying. So not trying to say doom and gloom and make everybody panic and freak out, but we do want to make sure we understand that Omicron is still COVID, no matter what the variant is, and that's what we need to keep spreading in the community and not necessarily listening to the fact that across the country they're saying it's not that big of a deal. Well, it's not that big of a deal for people who don't have pre-existing conditions. It's not that big of a deal for those people who are immunocompromised. It's not that big of a deal for those who have an immune system that's strong enough to fight it off. And that's not everybody. And a lot of people in our community don't have that. So we want to try to be as safe as we can. All right. With that being said, we're going to move on, unless there's any questions from the listeners or watchers. And we keep getting these individuals that are doing this spam comments in the comment section. I don't know why those are showing up. Interesting. Anyway, so HHS update. So last month, LaDon provided our tribal health educator provided a presentation on healthy weight. And so I wanted to make sure that we give updates on the upcoming activities for HHS. For Heart Health Month, which is the month of February, LaDon will be providing a 2-part presentation on around Heart Health Month. She has an article that's coming out in the February bulletin, and on, I think I have this thing. When this thing died earlier, it clicked off everything I had uploaded to show. There it is. So on February 15th at 1 p.m. Will be part 1 of the presentation. February 18th at 11 a.m. will be part 2. So watch out for the advertisement for that activity coming on Facebook and on YouTube, and also look for it in the newsletter. Also for Heart Health Month, our public health nurse Rebecca will be. She actually put an article in the newsletter on hypertension and the information that's hypertension is also considered a cardiovascular disease. So we want to make sure that we pay attention to that article. Maybe she'll be able to join LaDon and give her 2 cents in during the presentation. I just threw her under the bus, but she doesn't mind giving information because she didn't become a nurse for nothing, right? So so also we're going to be having, February is also National Children's Dental Health Month, and Rebecca was able to connect with a local dental hygienist, Janelle Trujillo, and she's going to be providing a presentation to the community via Zoom, a live presentation on the topic of dental care for kids. That's going to be February 14th at 1 p.m. Keep a lookout for that. And let's see, February is also Teen Dating Violence Month. Pretty Water put an article in the February bulletin, so there's going to be some quick tips and facts about teen dating violence. It is a pretty significant issue in the community. It doesn't get talked about as much as regular domestic violence because in my opinion and others' opinion, teen dating violence is domestic violence, whether you look at it, however you look at it. So there is a fact sheet in there on that, and so look out for that in the bulletin. So, and Thelma is going to talk about the tribal colorectal cancer. Um, uh, what do they call it, Thelma? Um,
The
it,
fit kits, the
well, it's a anyway. Go ahead, you talk about it.
hello everybody. Um, okay, well, San Ildefonso has been currently working with the um, Aztec, which is Albuquerque area Southwest Tribal Epidemiologist Center, and UNM on cancer. And some of you have received some stuff in the mail, which was a survey in the beginning. And the surveys, if you submitted the surveys, you were given a gift card for those. So a lot of you participated in that. So now this week sometime there'll be a kit being sent to those who are eligible from ages 45 to 75 living here in the Pueblo. I'm hoping that you would participate in this. It's very important. As you can see, colorectal cancer has now become the second most common type of cancer among American Indians, men and women in New Mexico. So the kits will be going out. Just please look out for them. If you've already, on your survey, it does ask you if you've already received your screening done, and if you have, you will not be receiving the kits. But if you do, if you have any questions on regards to the kits, how to use it, or what you need to do, how you need to send it, and feel free to contact one of us, myself, Claudia, or anybody on the COVID team to help you with that, and we will instruct you how to use it. But for those, like I said, for those 45 and 75 years of age, I hope that you participate in this. It's very important, and it's just to help us in the community. But I think that is it for that, unless you need to add anything else, Troy.
I don't have anything, but I do want to give this last few minutes. We're going to take questions if anything is coming up in the from the listeners and the watchers. So if you have anything on the tribal colorectal cancer uh, program or COVID or anything else we've talked about today, go ahead and put it in the comments, and we will answer them live. You have all six of us on to answer questions if you need. And just hold on here and see if there's any questions. I did want to say one thing. How about those Chiefs? Sorry, I had to say it. Um, Anybody have any questions? Oh, I did want to say we do still have masks available. So if anyone needs masks um, from the COVID response team, please call the hotline and let us know so that we can get some set aside for you. Um, we have both the surgical masks and some N95s while supplies last. So they are available. Let us call one of us and
Also, just wanted to add, Troy, too, that I did find some extra thermometers if anybody, you know, theirs don't work or having issues. We have some available. Just give us a call. We can deliver it, or you can come by and pick it up. Thank you.
Thomas, to answer your question, it hasn't gone anywhere since we were last on. I have reached out to them um, to get some kind of an update, and I haven't gotten a response yet. Matter of fact, I reached out again yesterday and haven't gotten a response, so we're still waiting. It's like that background music. Can you hear it? Leanna, is that the Santa Clara Clinic? Okay, so Leanna just posted in the comments that there is a booster clinic for youth over at um, Santa Clara Clinic. So if you have children or individuals that need to be vaccinated, please contact the Santa Clara Clinic because there were some issues in the past about getting appointments at Santa Clara for vaccinations, but apparently, based on what Leanna's posted in the comments, that they are giving um, uh, looks like pediatric doses over there. So give them a call, set up an appointment. Leanna, do you have a phone number you can add? I know we have it someplace here, but I don't know if you have the phone number.
The number to Santa Clara Clinic is 753-9421. And I believe these clinics are held every Wednesdays from 9 a.m. to 11 a.m. and those by appointments as well. And I know that they did call Claudia, I believe, last week when they had openings available. So she reached out to individuals to find out who needs the booster. So um, no one has called so far, but maybe they have all the appointments set up. Thank you.
What's the last four of the phone number again? 9421, you said?
Yeah, 1-753-9421.
Okay. What was the clinic time again?
It is from on Wednesdays from 9 a.m. to 11. Um, for to schedule an appointment with the Santa Fe Service Unit, the number is 946-9203, Monday through Friday from 8 a.m. to 4:30. For pediatrics, on here I'm looking at for the Santa Fe Service Unit is Monday through Fridays from 3:30 to 5:30. Um, Adolescents and adult clinics for the Santa Fe Indian Hospital is Friday from 9 a.m. to 3:15, and for Santa Clara Clinic is Wednesday from 9 a.m. to 11.
And those are places that we really want to focus on getting people set up for because of there not being a mass clinic that's coming up. Want to make sure that the community is aware that there are still opportunities to get vaccinated um, at the through IHS, but they are by appointment only. There are also other options. You can go to Walmart or go to CVS or some of the other pharmacies and Smiths that will also get you vaccinated. But I think that to keep your records together, if you got your vaccinations at IHS, it would be great to just get it there also, so it keeps all of your records together. Otherwise, your documentation's separated. As some people have found out, they got their first two of the series at IHS, had a hard time getting their booster, ended up going to Smiths or to another place to get vaccinated, and then now they have records in two different places, and it's hard to keep track of that sometimes if you lose your CDC card. So um, just pay attention to those options. Velma gave the numbers and the places to make the appointments, and we can get those folks who need their boosters get boosted, and those who have not gotten vaccinated yet get them vaccinated. That will continue to help us to keep the numbers down in the community. There are still breakthrough cases. I know questions are going to come in about that, but um, the likelihood of severe infection or hospitalization or death is a lot lower with vaccination. So um, if you are months outside of that 6 to 8 month range that they gave you to be eligible for a booster for Pfizer or Moderna, the likelihood of you getting really sick from COVID is really high. So getting boosted is one of the ways to help with that. If you got J&J, it's 2 months. About 2 months outside of that time frame, you're going to need to get your booster. So um, it's important.
Troy, any add?
Troy.
Go ahead.
Okay, so I just wanted to also add that if individuals are getting their vaccines, if they could just call us and let us know, so that way we're Thelma keeps a pretty good record of individuals that have already been vaccinated. So that would help us as to how many vaccines they've received already. Thank you.
Troy,
Yes.
may I add to that? I know that I had received a few phone calls um, asking, what if I lost my card? Because of people, I guess, forging different information on their COVID card, the COVID cards are not available. If you received your vaccine at the Santa Fe Indian Hospital, what they'll do is they'll print you out your immunization information. So it'll be a long form with all your shots that you had received, but they will not give you another card. So it's very important that you please either make a copy or save it in a good place so you won't lose it, just to make sure that you always have that with you. A lot of people are taking pictures in case they need it, but that's just some information in case anybody asks about that. Thank you.
Yeah, the COVID vaccination card from the CDC, they are almost like gold, and the way that the CDC issues those to the vaccine providers is that for every dose of COVID vaccine that they send to the vaccine provider, a card goes with it. So, for example, there's 10 doses in each one of the Pfizer um, vials to give 10 different doses of vaccine. So that with that, there's going to be 10 cards that come with those 10 doses. So when you call and ask if there's an opportunity to get us a new card, they're going to tell you no, because of that. They don't get extras. They get one card per dose. So it's very important that you keep hold and keep track of that card, because they will not give you another card. No matter how much you ask or beg or try to bribe them, they're not going to give you another card, because it would be a federal law violation. So, if that's what Delm was talking about, the another option obviously is to get the printout from IHS showing that you got your vaccinations. If you got your vaccinations through a state option, so any place that's outside of IHS, it's going to get registered into NIMSIS, which is the place that the online location where they store the records of vaccinations. And you can type your name in there and your information, and you can actually print that out, and it will give you the information about all the vaccines that you've gotten, not just COVID, but if you've gotten any other vaccines in the state of New Mexico through a state location, it will have your vaccinations on there. So that's good to know for jobs you apply for, or someplace that requires you have a hepatitis vaccine or something like that. You can get a printout and show that. But otherwise, IHS is a place to go, because nobody will give you an extra card, unfortunately. A lot of that is because there are a lot of people that are forging cards and handing out their cards to someone else so that they can have proof that they got vaccinated even though they didn't, which that's a lot of work to do, and all you can just get vaccinated, right? And not have to worry about that. So if you need an extra card, you're not going to get it. You're going to have to find another way. Take a picture of it, make a copy of it, and keep your original safe, because you're not going to get another one. Liana, so Liana put in a question in the comment section about, or comment, actually it is a question, to remind folks of, or I and her, but especially I can just say this for all people, of the mental health resources that are available. We have an agreement with 8 Northern and Circle of Life to have behavioral health services provided for all community members. In fact, every single month for the past 3 months, I've included on the front page of the HHS part of the bulletin information about how to contact Circle of Life for to get access to behavioral health services. I know this is a big issue right now because COVID has created such a problem for for people, their emotional health, their behavioral health, their mental health, and this is the front page that I posted up here of the actual bulletin. Um, there it is. That talks about the mental and emotional health. It's important to make sure we keep not just ourselves but the community safe, uh, and emotionally well, because COVID has created a big problem. Um, there has been an amazing increase of uh, suicides and mental health emergencies in the community, not in community, but across the country around COVID. But then there's just the regular stuff, the stuff we've been dealing with prior to COVID, that COVID has just made worse. And if we can make that a priority to make sure that we pay attention to how we feel, and as well as how our families are feeling, checking in with them to make sure that we, we're making sure people are getting the help and services that they need. But Circle of Life, as you can see on the screen, 505-852-1377 is their direct line. That number is something that, it does not get utilized as much. I get calls and communication from Circle of Life probably twice a month to kind of check and see what we need regarding behavioral health. And they are not getting a lot of calls. If you or your family member are having some struggles with mental health, emotional health, or behavioral health, or just really stressed and are having a hard time managing right now, if you don't feel like you can make the call yourself, call me. Call one of the members of the team. We will help you make that call. We will help get you connected because, it's hard for people um, who have not ever sought out behavioral health, who have never asked for help with their mental health or with the struggles that they have. Um, they need that assistance to get over that anxiety that they're having about doing that. And um, so contact them. They are available for us. We do have that agreement with them, and we should be utilizing them, at least until we get our own in-house substance use and behavioral health folks, which is one of the things I'm working on now, getting people on site to do that. But right now, that's what we have available. So, um, Thomas, so we have talked to them about it. We actually have a room set up over at the I lost it. No, at the what did you say? No, not the senior center. At the
A Rancho Club
Rancho. Thank you, Claudia. I was lost.
or property?
Rancho
Yeah,
Club.
Rancho property.
Yeah, at the El Rancho property, I actually have a room set up over there for people to go and do telehealth for Circle of Life. They provided us a computer with a camera, and it is set up there and prepared and ready for folks to see a therapist through Circle of Life via telehealth, because currently they are not set up or not willing to, based on the COVID numbers, to come on site and provide in-person therapy for people because of course the cases. Um, but they had, prior to the cases spiking again, they did offer to be able to meet people in public places to provide therapy, like meet them in a park or meet them in a public place in an outdoor area to provide counseling services for them. But again, this is going to be at the comfort level and the staffing levels of Circle of Life, because just like all the other communities and professions, they are not getting a lot of therapists that are applying for jobs right now. So they're short staffed. But you know, um, they are offering the services to the community. Oh, so Leanna put a suggestion in the comment section about visiting your primary care physician after you have experienced a COVID infection. And this is good information for just about every illness, especially respiratory illness that you have, or medical issue you have that you deal with outside of your doctor's office. Going to see your physician after the fact is actually a good thing. One of the reasons why that is with COVID is that Rebecca mentioned this earlier. Long COVID and post-viral syndrome is a real thing. There are people who tested positive for COVID in January, February, and March of 2020 who still have symptoms to this day. They have long COVID symptoms that they're experiencing because some people's bodies don't recover the same way as others do after they get COVID. There's also a pretty high percentage. I think it was the last thing I saw was like 60% of everybody who tests positive for COVID experience some sort of heart inflammation, similar to the myocarditis that the youth are getting from the vaccine. Some youth are getting from the vaccine. People are getting that myocarditis and pericarditis, so inflammations of certain parts of the heart after a COVID infection. And some of that inflammation does not go away right away, and you start having complications. People will start having fatigue. They start having psychological issues because there are neurological effects that happen after getting COVID that are difficult to handle. And you didn't have it before, but now that you had COVID, you're saying, man, there's something just isn't right. I'm still feeling these symptoms. I'm still, experiencing things that I never experienced before, and a lot of it as a result of COVID, because COVID is it does some things to your body. And that sounds like a really elementary way of saying it, but it does some things to your body. COVID can affect every single organ in your body, including your brain. So checking in with your primary care physician or checking in with a doctor after the fact is a really wise idea, especially if 2-3 weeks down the line after your 10-day isolation period is up and you're still feeling something. You might want to get checked because something might still be there. Things that you probably need to get treated now so it doesn't create a problem later on. Let's see. The community health worker position, Leanna, that is something that was funded. That was something that was funded through, sorry, our health council funding. And it is actually directed to help us manage our efforts with COVID. And it is a part-time position currently. I did just submit for some additional funding for a community health worker position that will help to fund additional hours for that, so potentially making that a full-time position. But that position is a $17 an hour position. That is actually something that the funders required us to do. No less than $17 an hour can we pay that position. So it's available and open. And I think it's a 20-hour position, 20 hour a week position currently. So if you have anybody who's interested, or you're qualified and you want to come and work with us, help us with, some of the issues that we are dealing with in the COVID response team and helping us to recover post-COVID, that position is there and available to anyone in the community or anyone that's qualified to work it. I don't have the actual job description in front of me, so I can't tell you what the minimum qualifications are, but I think it's just a high school diploma, and you're going to need to get certified as a CHW later on. Lydia, the long-term effects for kids. So kids are just little us's. So many times, the symptoms or the long-term effects are pretty similar to what we experience. One of the things that they've talked about with kids, though, is that you know the majority of them they recover perfectly fine because kids' immune systems are pretty strong. They're not like the older folks, like us older folks, that our immune systems are slowing down as we get older, and we don't respond the same. Um, the young folks recover pretty well, but there are some kids that are still having long COVID symptoms, not in as high a percentages as the adults are, but they are still having them. The neurological effects of depression. Some of them are having anxiety, and some of that is not because of COVID itself. It's because the fear that COVID brings along with it. When people get COVID, they feel like they're going to die, or the news is telling them they're going to die. So they start developing anxiety about it. And so they will start having anxiety and depression symptoms after the fact. But there are neurological symptoms, or neural effects in the brain, all human beings who get COVID, that could potentially cause those same things that are not related to fear of the disease. It's just that's how the brain is affected. There are some folks who have had breathing issues afterwards, so they're having a hard time recovering their breathing at the levels they were before that. Some kids will even have muscle and joint aches for sometimes months after having COVID, because one of the primary symptoms of COVID is muscle pain, right? Muscle aches, and that doesn't go away right away all the time. But these are not any different from the adults. The kids will experience almost the exact same symptoms of long COVID as the adults do, the ones who do have it. But like I said earlier, it's not, the kids don't get it as much as the adults do. Hope that answers your question. When it gets really quiet, that music plays in the background. I'm like, oh, that is nice music. Leanna, the Mental Health Awareness Month is coming up here soon, so that is something that's going to be talked about. I will be doing a live presentation sometime in the near future on that, anxiety and PTSD. They're saying that one of the epidemics inside of the pandemic that are going to come out of this is that there's going to be a lot of people who have PTSD because of COVID, because of the fears associated with it, and the fear of death and serious physical injury, which is basically a primary criteria for a person to be diagnosed with PTSD. So we'll talk about that. That's something that's coming up. We can't cover it all now. We've actually gone over time right now, but we will be talking about the psychological effects of our 2020, 2021, and now 2022 life. It is affecting us big time. The isolation, the lack of social engagement, not having the ability to go out and connect with the people we connected with prior to COVID. All those things have an effect, especially in communities where family and social connections are part of their tradition. So we do need to make that a priority, not just the physical recovery from COVID, but the psychological recovery from COVID. Because I had a conversation with Council Rep Thomas Gonzalez, about this, about how we do need to make this a priority, social and emotional health of the community a priority, not just wait until after COVID is done, but we need to start focusing on that now. You talked earlier, Liana, about support groups for youth. I mean, that's an important thing. We need to really start pushing these priorities to make sure that the community recovers Part of these grant funding, that CHW grant funding, and some of these other grant fundings, the title of their funding source is rebuilding after COVID. So a lot of our efforts in HHS are going to be on that, and I think the community needs to be part of that too. We can't do it by ourselves. The community needs to participate. Those individuals who have really trusted voices can come in and join us and try to build capacity within the community, especially with the young people, to make sure that we get better. And that's a good question, Liana. I actually about doing the blast with we're going to go live. I thought about that, looking at the number of people that are actually viewing live, and then the people that are viewing after the fact, and a lot are viewing after the fact. I think a lot of people don't know it's going live, but I think we some people also look at this and say, well, this is going on way longer than we thought it was going to, because we're going into lunch now. But these are important topics to talk about, and we do need to make sure that everybody is aware that this messaging is a weekly thing. We are going live every single week at 11 o'clock on Thursdays to talk about COVID updates and also HHS updates. But I think we're going to probably have to split the two, because we go into talking about things that are not COVID, we end up going a lot longer than we planned on going. So what does that mean, Liana? Get them to the doctor? I know you said just kidding, but that's pretty funny. But I wanted to start. Want to look at the time and honor people's times, not just the community, but us as a team, and start wrapping this up. I wanted to take a moment to thank all those individuals who tuned in to view us live today. All of the individuals that actually asked really good questions to help us to get these messages across the way they need to, and in a way that's understandable for everybody in the community. And I wanted to thank the team again for now our third week doing this live presentation for the community to help bring awareness to these different topics, especially COVID, especially how to keep the community safe, and some of these other topics like mental health and building capacity within the community. So before I disconnect and we log off, I wanted to give the rest of the team an opportunity to have any final comments if they have any. Ladon says she's good. Rebecca says she's good. Claudia, thumbs up, you're good. Thelma, you have anything?
Just again to thank everybody for, everyone for logging on. I really appreciate it. And, I hope that we answered a lot of, questions that you all had asked. And it's fairly new to all of us. So, of course, every one of us is probably nervous on there. We were at the beginning when Troy was talking to us about it. But and of course, he said that, once we start, we'll slowly get comfortable with it. But again, thank you everybody for being on. I really appreciate it. And you all have a good day and a wonderful weekend.
All right, folks. Appreciate you all. Have a good day. Have a good Thursday. And we're, like we talked about earlier, we're at 8 cases active. We want to get down to 0. So testing, social distancing, washing your hands, wearing your mask, extremely important. Let's do what we can. Keep the numbers down. Keep the community safe. Thank you, and have a good day.